We, of course, want to get the opposing view now as we've watched the president for about an hour. Joining me live from Capitol Hill, Republican Representative Eric Cantor of Virginia, the House Minority Whip. Congressman, you heard some of the president's Q&A there, and also I read a recent piece that you wrote in the paper talking specifically about seniors. Did he sell you on reform when talking about that in particular and focusing a lot on Medicare?
Kira, you know, I heard what the president was saying, and frankly, he hasn't said anything different today than what he said at last week's press conference. You know, the fact is that most Americans are very concerned about what they're learning of the Obama health care reform bill. And I don't think that the people of this country feel it is appropriate for us to hear the president say, you know, it's my way or the highway. You know, there are plenty of other approaches, and I think we can gain a comfort level if we take the time to get it right and not say that we must have full-on this government take over our health care system.
But he, time and time again, throughout that Q&A, said in no way, shape, or form, and he was very firm about this, said that, you know, we're going to make you do one thing or another. It's not going to be like Canada, he said, where your only option is to take what the government is giving you. He said this is strictly about reforming the insurance company and making it more competitive so you, the consumer, don't get gouged.
But the way to do that is not to impose some type of government substitute for insurers. I mean, right now, people are upset if they lose their job, they're going to lose their health care. And so we've got to make sure that we put forward a plan that allows folks to maintain that protection if they lose their job. But let me tell you this. I just met with a group of small business people from around the country. And frankly, their reality is not at all what the president is describing. That's, I think, where the disconnect is and why so many people in this country, in fact, the majority of Americans, feel very concerned about this plan he's pushing. What the small business owners told me was that this is a plan that will penalize them as job creators. We heard plenty of stories about small businesses downsizing, about the realities of what a payroll tax of 8% would mean, and about what a surtax on small businesses would mean. It would mean there's no way they could maintain the jobs they have, and in many cases they would say, look, I can't afford it all. I'd have to go in and allow or really force my employees onto a government plan. That's the reality of what the president's talking about.
Well, two things that I want to point out there. Talking just about not being able to afford it. I mean, premiums keep going up faster than wages, by the way. You've got deductibles on the rise as well. You know, healthcare costs are definitely a big drag on the economy. So something has got to happen to offer more competition to get those costs down. In particular, when you talk about loss of jobs and small businesses, and I mean, they're struggling tremendously, as we know, in this economy right now.
Kira, listen. You're absolutely right. We need more competition. We need to drive down costs. But I don't think anybody in America believes that Washington is the agent to bring down costs. What we've got to do is we've got to listen to what the job creators, the small business people are saying. And what they're saying is, allow me the flexibility to provide the coverage for my employees. Allow me to make sure that my employees have what they need. It is really just a false choice that the president is saying. He's basically saying it is a government plan or nothing. That is really not where this country is.
But that's not what he's saying. I mean, they're laying out saying, look, it could be cooperative, state-supported gateways, or a federal government public option plan. He's not saying it's absolutely one way or another.
Kira, what we heard from the small businesses, there is no way that you can see an instance where the government can fairly compete with the private sector. I think that's intuitive.
Well, the private sector has a lot of money, right?
Well, but listen, we need to make sure that the costs are brought down. I don't think anybody argues that point. Nobody is accepting the status quo. But the reality of what President Obama is proposing is putting the government in competition with those in the private sector. Employers, one after the other, have said, if you do that, there will be no other option than for us to shed our health care and allow all of our employees then to go into the government plan. When you look at it, those that have health care in this country, an overwhelming number of Americans like what they have. They just say it's too expensive. So let's focus on bringing down those costs. And that's really where we've got to focus here if we're going to get something done. It is not this question of you've got to accept this or else. And that's really, I think, where the difficulty is and why there's a bipartisan majority in Congress against the Obama health care bill.
And if you want to read more, you can go to the Richmond Times-Dispatch and actually read Eric Cantor's column there. He was a guest columnist. It was published on the 12th. Healthcare shakeup will make things worse. Thanks for adding perspective to the president's comments today. Appreciate it, Congressman.
Kira, thank you.